It is my great pleasure to welcome you to Rwanda and to the 7th World Healthcare Student Symposium that is being held under the auspices of the University of Rwanda and hosted by Rwanda Pharmaceutical Student Association, RPSA. WHSS 2017 attracted over 1,200 delegates from 32 different countries, including the healthcare students, professionals, members of civil societies, government institutions, and the private sector. WHSS is a unique platform in the world that brings together different young people from different healthcare fields. It is therefore to discuss about global health challenges and shape the future of healthcare. We are very glad as Rwandan citizens and as young people to be hosting this conference in our beautiful and clean city, Kigali. During the next 5 days, our discussion will be aligned with the theme towards the SDG Agenda 2030, the law of a multidisciplinary approach in healthcare. Our program is designed in a way that it is exciting and engaging. We hope it allows discussions and debates that stimulate thoughts and ideas on how we can collaboratively address global health issues such as non-communicable diseases, inequalities, infectious diseases, and mitigate future pandemics such as Ebola in a multidisciplinary way. Thank you so much for coming to this symposium. It is our hope that you have a comfortable stay and enjoy the program and related activities of the conference.
I am Mohamed Bella Jallo. I am from Freetown, Sierra Leone. So this is my first time in Rwanda. So my expectations at the WHSS, I've come here to learn, network, and meet different students from all around the world. So I'm optimistic that this is going to be an amazing event. Thank you so much.
My name is Victoria. I'm from Switzerland, and I'm president of the Swiss Pharmaceutical Students Association. I really enjoy my time in Kigali so far. It's a really clean city, it's warm. In Switzerland it's currently winter. And the people are very kind and motivated here. And I expect at WHS to meet a lot of motivated healthcare students from different countries, engage with them and compare our healthcare systems and our study systems. Thank you so much.
Hello and good morning in this beautiful country. I'm Faisal Majzoub from Sudan. Thank you very much for hosting us here. I like this country, I like the conference. People are friendly and kind. I think this will be a great experience. I hope we'll all enjoy it.
My name is Jane Zwaneje Christelle. I am from Rwanda and I'm a medical student. My expectation in WHSS is to learn more and get more skills and knowledge. Thank you.
Honourable Minister of Education, Country Rep for WHO, Deputy Vice Chancellors, Director General, colleagues, faculty, friends, and of course students, welcome to this place. Universities exist to create a space in the lives of young people. In healthcare, 5-6 years, for other programs 3 or 4 years. We as a university community create a space in your lives, a space in which you should be provided with the opportunities to become the best kinds of people that you can be as you enter in our professions lives of service, lives of vocation, lives that are driven by a calling to serve other people, lives of sacrifice. And so I salute you all for the lives that you're committing to and entering.
On behalf of the government of Rwanda, I welcome you all, and especially those who have traveled to Rwanda for the very first time. Welcome to Rwanda, the beautiful country of Thousand Hills. And I hope you will have time to explore the beauty of Kigali in particular and Rwanda in general, and learn more about our rich cultural heritage and take full advantage of our warm hospitality during and after the period of this conference. I understand that the World Healthcare Students Symposium is the world's largest students' conference, a global multidisciplinary biannual event which gathers healthcare students and professionals under one roof. The government of Rwanda is committed to support young people initiatives such as this because we believe that young people play a vital role in developing communities and nations in all sectors. I therefore wish to once again congratulate Rwanda Pharmaceutical Students Association and the University of Rwanda on successful bidding to host this great gathering and making such efforts to make it a success. Congratulations. Healthcare students make a great contribution to communities. Here in Rwanda, generations of students have empowered local people, training them in life skills, providing cows, and getting people into employment. They support people living with HIV and raise awareness of HIV. Most recently, our very students from University of Rwanda have launched a web-based initiative in sexual and reproductive health that won an award from Imbuto Foundation. I say this opportunity to thank Her Excellency, the First Lady of the Republic of Rwanda, for Her Excellency's advocacy and support to the education and health sector with special focus to the most vulnerable young girls, boys, and children. Rwanda has made significant strides in achieving the Millennium Development Goals and has been ranked among the best in terms of achieving health-related goals such as reducing maternal and child mortality, eradicating HIV, AIDS, and malaria, among others. And we are still committed to implement and achieve sustainable development goals in general, and goal number 3 in particular, to ensure health lives and promote well-being for all at all ages. Distinguished guests, ladies and gentlemen, the structure of this conference, combined with the availability of the high-caliber speakers from a wide range of reputable organizations, will be a great opportunity to inspire the university students who are eventually the next generation of the healthcare professionals and leaders in global health. I hereby urge the students, academic staff, researchers, and healthcare professionals in Rwanda and in the region to maximize all the potentials and opportunities as reflected in the objectives of this conference. I hereby now declare this 7th World Healthcare Students Symposium 2017 officially opened. I thank you for your kind listening, and I wish you a fruitful conference. Thank you once again.
Thank you. Our professional photographers have to alert us when that is done. Yeah. So I will ask you together to give an escort to the guest of honor as he leaves, and we prepare for the first panel of the day.
Once again, thank you so much for having time to be here this morning. And to my panelists, thank you for having time to be here this morning. So I want to start off the conversation with the fact that in the African region, in the African perspective, Dr. Alu, but I would love us to put in mind that these goals we're talking about are long-term, meaning that we need to look at strategies that can be sustainable to be able to achieve them. Now, we cannot achieve this development if other things are not put into place. Looking at poverty in 2012, the Africa Development Bank highlighted that 43% of all Africans still live below the poverty line. Looking at quality education, among many other challenges, I want to start off with the fact that what do we need as a starting point to move towards achieving good health?
When you look at the way we define health, we say it's a state of physical, mental, and social well-being, and not just the absence of an illness. So what does this tell us? It tells us that, look, health is not only about good health or having good health care. It's not only about the health system. It's about so many things that come together. So if we must have good health, the starting point will be actually having this multidisciplinary approach, which looks across so many things.
Also very aware of my own cultural humility, and I have to be very honest that the U.S., why some people look to us as having all of the solutions and more money than anyone needs, we have not achieved global health or universal health. We still struggle as the most developed country with one of the worst maternal death rates in any developed country. It's on the rise, unfortunately, not on the decline. And we have to look at the social determinants of health, the structures that are leading to that particular demise and concern. And it is, as the doctor said, beyond just health care. In general, if you go to our hospitals and a woman experiences a health crisis during delivery, the management of that health crisis is usually quite well done. But we're discovering that our citizens are experiencing high rates of obesity and diabetes. It's a lifestyle and culture problem across all of our races. But there are certain racial disparities and ethnic disparities in our access to care, in our poverty levels. So we struggle as well to achieve better health and to work toward the goals. So I'm happy to participate in the conversation. I can honestly tell you we don't have the answers, but we have the desire to participate in the conversation, and I think that's what will move us all forward toward better health.
Started to focus on research that is rooted in people's lives, is rooted in the experience that people have, and research, therefore, that has an impact on people. So beyond the publication of the research, what is happening with the output of that research. The other thing that we've done, Maggie, and this is from independent verifiers, is that we've begun to change the culture within the university, the way in which we do things, the way in which we conduct research, the way in which we inform education. One of the key things is that we need to have an education system and a curriculum that's much more flexible, much more agile. So in resource-poor settings, the luxuries of medical curricula and nursing curricula get squeezed out often with an obsession with knowledge-based intended learning outcomes. So we lose the issues around understanding the healthcare system. And we know that many students who come to universities don't always have experience of the healthcare system in their country, from village level right up to tertiary teaching hospital level. So we need to help people understand the system. We need to help people understand the model of healthcare. So curative model of healthcare is probably pretty outdated in the world. We're looking at a much more palliative model of healthcare.
My name is Letla Khanola from South Africa. I'm a pharmacist by profession, and I work in PhD facilities now in a particular province, and we're working on ensuring medicine availability in primary healthcare. So my question will touch on basically almost all the goals. As much as we are healthcare professionals, we're mostly focusing on goal 3, but how about at some point we need to take off our heads as health professionals and look at all other goals. For example, whether you are a pharmacist, an engineer, or wherever, all the goals in a way are interlinked. And if we are able to build capacity in civil society, we can start by schools, primary, high school. If you teach the kids how to wash their hands, how to eat healthy, and how to save electricity and water, those things eventually will work out to assist in other goals and also ensure sustainability. As a child, you grow up, this become a way of life. I think in terms of sustainability, we can look at it in that way, but I just want to ask, how much support do we have from our the education side? In terms of training, our ministries of education, to have enough support to train civil society, kids, and all other individuals except professionals to assist. Because for us to achieve all these goals, we all have to work together, professionals or not. Because if we can all work together, we will see all these goals as they interlinked, and we see the last goal which talks about partnerships and allow sustainability. So I just want to ask, how much support do we have from the Minister of Education in terms of capacitating and allowing other civil society members to be able to participate and assist in implementing these goals across the globe?
First and foremost, I want to remind you that WHO is a member state organization. So the people you see in WHO, they are only the secretariat. All our decisions are taken by the ministers of health of your countries. So it's not by us. So that is one of the things, we're doing. And because of that, we have the World Health Assembly, where we, based on our work in the countries, we look at what the issues are, and then we present them to your ministers of health to say, look, this is what the situation is. This is where we think you should put money. This is where we think politically you should act on. So this is one way. Of course, in each of the regions, we have 6 regional offices. We have what is called the regional committee. They take place once a year. Again, ministers of health, they are the ones that take all the decisions. And what we do is that we provide them the evidence based on our work and our partnership, to take decisions.
My name is Christophe Mumio from University of Ibadan, Nigeria, and I'm a director at the Federation of African Medical Students Associations. So I have 2 questions. The first question is about interprofessional rivalry, especially in my country, Nigeria. There's a lot of rivalry between nurses and doctors. So it's very hard getting the different healthcare professions to work together in order to achieve the Sustainable Development Goals. So maybe Dr. Olu has, at least since it was working in Nigeria before he came, if he has an idea of how we can actually fix the interprofessional rivalry. And the second question is on cultural perspective and healthcare, SDG 3. For example, we did a breast cancer awareness program, a Pan-African awareness program at the Federation of African Medical Students Associations recently. And traditionally, we do go to cities for free screening exercises and awareness programs. But this time around, we're like, let's go to the remote communities, a very remote community in Ibadan, like Anojaoba. So what we realized there was that people actually don't want healthcare. We're doing awareness programs and screening exercises, and people are like, no, that's not what we want. We want money. We want good food. We want this. And we're very surprised that even people that we're trying to help, they actually don't want this. So how can we fix this? How can we get around to actually even getting people to want healthcare interventions? Thank you very much.
Great questions, and far too much content for us to digest in 1 hour and to give you good answers. So we will be using the technology and certainly here for the conference. I just want to comment in general, and it's really a quote from Dr. Tedros, who's the WHO General Director General, that no health system is perfect. WHO's experience, expertise, and technical know-how are all assets from which all countries can benefit. So this kind of a conversation, a sharing of the priorities from your country, the learnings from other countries, and the partnering will probably lead us to accomplishing many of the goals and get our work moving forward. So thank you.